Leading in Health is quite a unique consultancy firm. We've been able to bring together years and years of experience in the health sector with behavioural science, with coaching, with leadership development to create what we believe is tailor-made solutions to situations that agencies have. In the past, having worked in the industry, there's been too many of these off-the-shelf programs, and there's a common denominator amongst them all. What we want to do is to create a unique opportunity. We want to take individuals and individual businesses and tailor make their solutions for them.
So, what we're finding at Leading in Health is that boards of management and executive teams are made up of a group of individual leaders that are promoted typically around education, technical capacity, and how long they've actually been in their roles. But what we're finding is those don't necessarily produce the best results when we put these groups of people together, that they may work as silos and they work individually and independently of each other because of their technical expertise. They're not rewarded for their capacity to connect and engage with the other people on their team. So this is what we bring as a collective at Leading in Health. We teach leaders, both at a board level and an executive level, how to connect and engage with others, how to actually have insight and awareness of different leadership styles, how to communicate with them, how to actually build cohesion across the team so that that team can actually produce great results and have flow on across the organization.
Leading in Health supports agencies through three primary programs. The first is our governance leadership program, and that's really working with boards and taking them from being a board to a brilliant board. We combine the operations of the board with behavioural science that we have, and we create a new paradigm for those boards. The second element that we have is executive leadership development. And that's really moving your executive team to a new dimension. It's giving them a focus on what's important to them and also their organisation. It improves their performance outcome. It makes a new team dynamic. It works for the organisation. And then our third program is around health advocacy. We work with organisations. We are uncommitted to either the board or to the CEO or to the operational management, but we want to get the best outcomes. We look at the performance of the governance, we look at the performance of the operations, and we help CEOs in that nexus between governance and day-to-day management. They are the friction point, and we need to make sure that there is as much synergy in that environment to improve the outcomes, to achieve the strategic goals, and to do it in a timely fashion. We want to improve performance, we want the best outcomes, we want to make sure that that happens both for the individual and for the organisation. So that's part of our driver behind why we have Leading in Health. We want to create this world-class leadership environment. We want to have the best leadership in the world right at our health services to deliver the outcomes, to deliver the performance, to deliver good patient care. We think that with our programs, they're a unique opportunity and a once-off opportunity to actually take you to that next level. Don't sit in the mediocre. Don't pull yourself down to the average. Be able to elevate yourself through our assistance, our leadership, our programs that will deliver top performance, not only for you, not only for your board or the individuals within your organisation, but for patient care.
I believe from where I sit, what I see is we have boards of management and we have CEOs, and there's this unique nexus between what happens at board level and at executive level within an organization. And oftentimes there's conflict, and there could be a breakdown in communication that happens at that level. So our health advocacy service is about coming in as an independent, neutral party to actually foster the relationship that happens between board and executive. So if the CEO and the board aren't getting along, or they're not clear on what their performance objectives are, or there's behavioral problems going on at that level, we come in and we work with both parties to actually help foster a better, healthy relationship so that the organization can progress forward.